Hello and welcome. This video is about what happens after total knee replacement surgery and is meant to address concerns that patients and their families may have. Proper wound care is important following the surgery. The wound should be kept clean and dry. Ice packs can be used to reduce the swelling, and nurses will help to monitor the wound and change the dressing as required. The medications that you will receive in hospital include pain medication, blood thinners, and stool softeners. You will also be placed on a special diet to ensure that you have all the nutrients that you need to heal properly. Physiotherapy is important following the surgery. You will be assigned to a physiotherapist who will teach you how to move about and walk with an assistive device such as a walker or crutches. You will also be assigned to an occupational therapist who will help you with activities of daily living such as dressing.
You will finally be discharged to go home if you can get in and out of bed on your own, have good pain control, can eat, drink and use the bathroom on your own, can walk with an assistive device, can do the home exercises on your own, and understand when to return to the hospital. You should prepare your home to ensure that it is safe for your return. This should be done before the surgery. You can do so by removing any loose rugs or carpets, removing any electrical cords which may be lying on the floor, moving around furniture so that you are able to walk around with your crutches or walker, placing a chair in the shower to avoid standing for a long time, and if possible, a friend or family member should be available to assist you with activities such as cleaning and shopping. With regards to the wound, you should keep it clean and dry. Cover the wound with waterproof dressing or a plastic bag when you have a shower. Continue icing it to prevent the swelling. Only change the dressing when you are told to do so. The staples should remain on as they will be removed at your first post-operation appointment. You will most likely be discharged with the same medication you would have been taking in the hospital. It is important that you take the medication as instructed. When you are at home, you should eat a healthy diet consisting of fruit, vegetables and protein such as chicken, fish, eggs and meat. And you should also drink a lot of water. This will help with your wound healing. You should try to remain as physically active as possible. You can do so by continuing your exercise program, walking around with your walker initially, and then trying to increase the distance you walk each time, and carrying out all your normal activities of living, including showering, cooking, and dressing. With regards to other activities such as work, sports, and driving, you can go back to them after your doctor tells you that it is safe for you to do so. Remember to give yourself time to adjust to these activities as they may feel tiring initially. You may be wondering when you should return to the hospital. The main complication of this procedure is an infection at the operation site or blood clots forming in the vessels of the leg. It is important to look out for signs of these two conditions and to return to your doctor if they do occur. The main signs of an infection would be fever, increasing redness and swelling of the wound, increasing pain with rest and activity, and drainage of pus from the wound. And the main signs of blood clots in the vessels of the leg would be pain in the leg not in relation to the wound, and increasing swelling of your calf, leg, and ankle. The blood clot can sometimes dislodge from the vessels and travel to the lung. The symptoms to look out for would be chest pain and difficulty breathing in this case. You should also return if you fall and injure your knee. And of course, you are expected to be seen at your first post-operation follow-up visit.
As previously mentioned, physical activity and use of the knee are very important after the surgery. We are therefore going to end this video with a few examples of home exercises that your physiotherapist will teach you. Thank you for watching, and we hope that you found this video informative.
Quadriceps sets. So lie on your back with your legs straightened. Contract the muscles in your thighs, keeping your legs straight as if you want your knee to press down on the bed. Hold for 5 to 10 seconds. Do this for 2 minutes and rest for 1 minute. Bed supported knee bends. Lie on your back. Move your foot towards your buttocks by bending your knee as far as possible. Hold for 5 to 10 seconds. Repeat until your leg feels tired. Straight leg raise. Lie on your back with your legs straightened. Contract the muscles in your thigh. Lift your leg up from the bed. Hold for 5 to 10 seconds and slowly lower your leg. Repeat until your muscles feel tired. Knee straightening exercises. Lie on your back with your legs straightened out. Place a rolled up towel under the heel of your foot. Contract your thigh muscle and try to make your knees touch the bed. Ankle pumps. Lie on your back with your legs straightened out. Prop up the ankle with a rolled towel. Move your foot up and hold for 5 seconds. Then move your foot down and hold for 5 seconds.
With your foot resting on the floor, bend your knee as far as possible. Slide your upper body forwards. Bring your healthy foot behind the foot of the operated leg. Bend the knee of the operated leg as far as you can.